Yeah. Yeah.
My name is Portia Braxton. I'm the Prevention Coalition Coordinator with the Butler County Family and Children First Council. We are in our 12th cycle of the Pride Police Data Survey. We are the preventative wing of the task force. And we as the task force, we address the substance use in our community. We work with the Butler Health Department, Mental Health Board, and a variety of other agencies and community partners. The Prevention Coalition Subcommittee. We help to bring the Pride Student Youth Survey that we're here today and online. We all come together to bring that to share. So we as partners here today, we have Sarah from Prevention First. And I will introduce, we have Uki and Rachel from Envision Partnership. And they are going to share what a school-based and community-based prevention, what that looks like in our communities.
Here. So most people probably know what prevention is, most people who are here, but it is very, very broad. So we like to say that prevention is both wide and deep. So what we mean by this, we kind of break it up into two sections with our school-based services and our community-based services. So for school-based services, we break that down into three types of categories. So the first one is universal, meaning that everyone will learn, it's applicable, it's beneficial to everyone, regardless of circumstances or situations. So this is life skills training, PACS training, which is training for adults and parents that teaches how to incorporate self-regulation to children. And then the selected group is for at-risk populations. So Fierce Girls is a group that meets at Hamilton High School, and Celebrate Me is also a group that just provides educational support for our students who might be at higher risk, who might have experienced some type of trauma, various different things can put people at risk. And then lastly is indicated. So this is where there has been an incident or something has been indicated that support and education is needed for this student or group of students. So if they've been caught with vaping or marijuana products, then they can go through early intervention education where we do cessation training or things of that nature. And then, okay.
As again, going back to what Rachel said, so it is broad, so it's wide and deep. So this is our deep portion with it being community-based. So with our coalitions, sometimes they're based on geography. So in Butler County, there's many different coalitions, as well as they're all issue-based. So whether that be like Healthy Hamilton, which is like overall health and wellness, or tobacco policy, or overall like mental health or suicide prevention, there's a focus for all these coalitions. We also offer after school programs. So that's Big Brother, Big Sister, CBI in Middletown. There's EDGE, there's HYPE, there's Boys and Girls Club. All these different organizations are ways that prevention can be taught to our children, even in that after school kind of setting. There's also policy. So I'm the Butler County Tobacco Policy Coalition Coordinator. So this is where policy comes into place. So we have a tobacco retail license that we're currently trying to put out in the city of Hamilton in order to protect our youth, especially against these harmful devices of e-cigarettes and the vaping kind of epidemic that's occurring. There's also media campaigns. So you guys drive throughout Butler County, you probably see some prevention billboards or signage, whether that be change the game, be accountable, different prevention kind of strategies and education. There's also trainings and skill building. So those are like our QPR teachings and skill overall, just skill building. As well as there's alternative events. So we offer many alternative events in our community, and those are substance free and they're family oriented. So to bring the community and families together, as well as provide that prevention aspect as well.
And so this is kind of our commercial. We're kind of brought here today, and a lot of this work is supported by the Substance Abuse and Mental Health Administration. And we have a Prevention Plus grant. So it's really focused on looking at children that have experienced trauma and how do we stop the cycle of intergenerational substance use and misuse and trauma in our community by creating more resilient youth and a more resilient community. We hope by year 5 of this grant that we have an SBIRT system set up. So SBIRT is screening, brief intervention, referral to treatment, so that all kids are screened when they're in schools, just like that eye exam or that scoliosis test, because we know a lot of times our high achievers have other things that are going on at home too. And sometimes they're not screened out, or sometimes us as adults are just not asking the right questions. So we're hoping to incorporate that along the way. And so why prevention? Why are we passionate about prevention? Probably many of us who have come to this work know somebody in our life who have struggled with substances. And we know that we can actually do something to change the trajectory of kids' lives. We know that 90% of Americans with substance use disorders started before the age of 18. So it's why that early intervention is really, really important. We also know that kids have these risk factors, and we can build in these positive protective factors to help mitigate the risk of forming a substance use disorder and struggling with substances. And then it's really cost effective. So for every dollar that is invested, we save $18 in those more expensive services. And we know that only 5% of the budget is usually invested in prevention. And we're spending all this money, where if we work with prevention earlier on, we could save a lot of money in the long run. And so we're really excited because the data that schools allow us to get from these student drug use surveys and Panorama, which you're going to hear about, really informs and impacts and shapes our strategies. And so we're going to be looking at a couple things that Sarah will talk about too, but we look at key measures. And so in our world, it's 30-day use of these different substances, youth perceived risk, and parent and friend disapproval around harm. Also, we know that although our numbers look really good, it's all green boxes because we saw decreases across the board on 30-day use. We were just coming out of a pandemic when this survey was taken last fall. And that means that youth had less access to substances. We also are a little bit worried about the long-term impact of the pandemic because we know a lot of adults were drinking more and maybe using substances more at home. And so we're not quite sure how the long-term impact of that is going to look like. And then we really have our eyes on e-vapes and marijuana. I say e-vapes because e-vapes are a device. And so some kids are using that device to vape tobacco. Some kids are using that device to vape marijuana. And you'll hear a little bit about some of our plans around trying to decrease access and to make sure that we can increase that perception of harm, because the perception of harm has gone way down around marijuana with many of the messages in the media with medical marijuana coming to the state of Ohio. And so I get to talk to you just a little bit about Panorama, which is something new. So our student drug use survey is focused on 7th through 12th graders. And we know that kids actually typically use substances before 7th grade for that first time of use, average age. And so Panorama was an initiative of several of the schools in Butler County that were using this kind of database screener questionnaire that looked at different social emotional learning components. And there were 2 schools that were using it, and 5 schools came together to pilot kind of a countywide working group around Panorama. And we were focused on student well-being, school environment, emotional regulation, what those relationships with teachers and other caring adults look like. And they allowed us, because we helped support them through the grant for this project, to ask some questions about what do our 3rd and 6th graders know about different substances, what's their perception of harm, and what protective factors do they have? So we could get some more good data on 3rd through 6th graders. And this is what we learned. So we learned in asking, what do you think are these different substances like drinking alcohol, smoking cigarettes, electronic vaping, and using marijuana? Is it safe, unsafe, or I don't know? And as you can see, I always like to start with the positives. Our blue, many of the kids are identifying that those substances are not safe. and a few that think they're safe. But what really stood out on this slide to me is 23.9% of our kiddos, 3rd through 6th grade, don't know if marijuana is safe or unsafe. And it's not that surprising because I think there's a lot of adults that are questioning, what is safe and unsafe as there's messaging. But this is an area that we really would like to look at and spend some more time focusing our attention on. The other question that we ask is, do your parents and teachers talk to you about the dangers of alcohol and substance use? And I want to tell you, I've talked to some of the counselors and some educators, even on this call, because Panorama is going to be administered, it was administered this last fall, and then it's going to be administered again this spring. So we see that our parents are doing a pretty good job in talking a lot, often or sometimes, about the dangers of alcohol and substance use, and that's good. There's this national Talk They Hear You campaign because we know it's a protective factor that if parents or caretakers are having this conversation, it makes youth less likely to use those substances. Teachers, I think we have a little bit of work. So there's a lot of seldom, never, sometimes with educators. And we're hoping that those numbers might change by the spring when some of those kids have had evidence-based prevention classes or DARE or Red Ribbon Week. And as those relationships have been built, because you got to remember, a lot of these students were virtual and not building those relationships with educators, and educators have a lot on their plates with trying to keep up with that learning loss and teach the math and the English and everything else. So this is another area where we're going to be keeping our eye on. The other question that we wanted to know around protective factor was, I can discuss my problems with one, either adult at home, adult at school, or friend. So there's very similar language on the student drug use surveys around this. And as you can see, adults are doing a pretty good job at home. And so we're thinking maybe this might be some impact at the pandemic of those that had positive supports in their life that maybe had more time to have some of these conversations. You can see friends and peer groups, even in that 3rd through 6th grade, we're doing pretty great with having a lot or often someone to discuss problems with. Adults at school, we've got a little bit of work to do. And so we're gonna dive a little bit more into that. And then for me, I'm just really concerned about any kids that fall in that seldom or never, where they don't have an adult at home or at school or a friend to talk to. And how do we identify those kids better? And so I'm going to pass it over to Sarah from Prevention First, who knows these numbers inside and out. She is our resident data geek, and I love you for it because I'm a data geek right there with you. Yeah. But she's going to talk a little bit about the trends that we saw with our Butler County numbers.
So hello, everybody. For those of you who don't know me, my name is Sarah Stallmiller. I'm the manager of evaluation at Prevention First. So we are a regional substance abuse prevention agency for serving all of greater Cincinnati. So even, southeastern Indiana, northern Kentucky. But then we also work on several statewide projects across the state of Ohio. I handle all things data and evaluation at our agency. So I work with Pride surveys to implement the student survey in our schools in greater Cincinnati, really Southwest Ohio, because Kentucky and Indiana have their own state survey. And then just any sort of programmatic evaluation and things like that. So if you ever want somebody to talk to data about, I'm here. Like Beth, I'm a data geek. If you ever are like, I don't understand this, give me a call, shoot me an email. I'm happy to share and chat about data with anyone who is willing to listen. So a little bit about our student survey. So we implement our student survey every other year. So we start registration early into the fall of the odd years. So we started collecting this data and getting schools registered in fall of 2021. The survey window was open from September 15th to December 17th this year. So that's when all of the schools collected data. And so then Butler County had 14,000, about 500 students were return surveys, and then that is the number of students that pass through our honesty checks. So we do have a series of honesty checks in place. There is a big complicated formula that Pride Surveys implements to try and weigh the likelihood that there was honest or students were honest or not with that survey. So, and typically, because I always get this question, so they say good amount of honesty checks, and if honesty checks are working, you'll see about 1 to 5% of surveys get pulled or flagged. And we see about 3 to 3.5%. So we're right in that window of flagging, the surveys that we anticipate would be dishonest. But yes, our survey asks a wide range of questions. So primary focus is on substance use. But then also we ask questions around other risk and protective factors, school safety, mental health, just general school environment, things like that. We get some parent information as well. And we work closely, you're good, you can keep it on here, and just we work closely with as many community partners as we can to help them utilize data and give them any sort of data that they need. So, and we appreciate the partnership with everyone in Butler County who helps us to get good data for all these community agencies up here. So I should say our office is located in Norwood, Ohio. So this first core measure that we like to talk about is past 30-day use. So this is asking students in the past 30 days, have you used the following substance? And this is just a simple yes, no response. So regionally, you can see our data came from Butler, Claremont, Hamilton, and Warren counties. And then Butler County is obviously just the county or the school districts in this county that participated. So you can see for alcohol, electronic vapor products, Butler County was a little bit lower than the region. Marijuana about the same, cigarettes about the same, and prescription drugs about the same. And then we always like to look at trends from the last 20 years or the last 10 years to get an idea of where we were and where we're headed and how that looks. So you can see across the board from 2020 to 2022, we saw decreases in all of our substances. A few didn't change quite as much, like we can see with prescription drugs and cigarettes. But still, given how low they were, a decrease like that's pretty significant. But we saw really sharp decreases for marijuana, alcohol, and electronic vapor products. The next core measure that we like to talk about is perception of harm. So this is asking students, how harmful do you feel the following substances are? And this is the combined percentage of harmful / very harmful. We report it that way just because that's the best indicator, and that's also what several of our local coalitions that are DFC funded and just other federally funded grants and local grants to report it that way. So you can see the highest perception of harm we have is for cigarettes and tobacco and prescription drugs. Those are both over 80%. Next highest is alcohol at around 75%. And you can see that Butler County falls right in line with the region for this as well. But then electronic vapor products just under 70%, and marijuana is the lowest at about 60%.
And then I'm going to get on my soapbox. So we are really watching that perception of harm decrease around marijuana. And we've got our eye focused on SB 261. We did some advocacy with our legislators in the state house because there are some proposed changes to the medical marijuana program in Ohio and moving the regulation from the pharmacy board to the commerce board. And that would make marijuana much more of a big business. It would also open up maybe some additional locations and open up some avenues for social media advertising. And we're very, very, very concerned about that. There also is a group that's called Regulate Marijuana Like Alcohol. And so they are trying to push a ballot initiative in the fall. And so we know that if recreational marijuana comes and there's more access, then that perception of harm goes down. So it's something that we're really going to be working on.
Mm-hmm. Absolutely. And so then just kind of high level, talking about alcohol a little bit more specific. So we saw 86.2% of students report that their parents disapprove of alcohol. So this question is, how wrong would your parents feel it would be for you to use the following substances? And just like perception of harm, this is that combined percentage of those who said their parents would feel that it was wrong or very wrong for them to use those substances. So we see 86.2%. which is really high. It's honestly tends to be one of our lower ends of parental disapproval, just because over time, we've seen consistently that students say that friends is their number one source of every substance, and usually it's other is their second highest, but for alcohol, parents is usually the second highest source of students reporting that that's where they get alcohol from is their parents. So we do see that being, like I said, one of our lowest reported for perception of harm. And then past 30-day use, so 10.2% said that they used alcohol in the past 30 days. And like I said, we saw a decrease, and I know Beth mentioned this too with the pandemic. We see decreases across the board, and really what I think led to that is just that lack of opportunity to engage with it. So it's definitely something that surely we can celebrate and be excited about that decrease, but also really paying attention to the spike that we might see in socialization and opportunities to engage with substance use. And then 75.7% reported that alcohol is harmful or very harmful to their health. And then average age of first use, 12.3 years. So a little bit lower than what 2020 was, but that's a pretty consistent, the 12 to 13 years of age. And like Beth said, that's why it's so important that we start to pay attention to it in that 3rd to 6th grade range and really make sure that we're getting in that education as young as we possibly can. Just another snapshot at marijuana. 88.9% said that they believe that their parents think it's wrong or very wrong for them to use marijuana. 7.2% report marijuana use in the past 30 days. And then 60.7% report that marijuana is harmful or very harmful to their health. And so as we talked about it before, that is the lowest of all the substances of perception of harm. And then 13.6 years of age is the average age of first use, and it sort of went down, but I think it actually went up. So, And then, so as our field is continuing to evolve as prevention, we learned that there is an increasing.
Sorry, my tobacco, I was super speedy quick.
You're good. I thought there was another one, but I'm just gonna
Advancing
roll with it. So looking at tobacco and electronic vapor products. So for parental disapproval, we see 93.5% put that their parents disapprove of use, and then e-vapes is 68.7%. And then for past 30-day use, so for all of our substances, so for all the questions, it's framed up as any tobacco. And then for past 30-day use, it is just cigarettes. That is just the federal standard that's set for question guidelines. So I always like to clarify that. But 2.3% of students said that they'd smoked all or part of a cigarette in the past 30 days, which that is probably one of the greatest wins of public health of all time, is the drastic decrease that we've seen since we've been collecting this data over the last 20 years of cigarette use amongst teenagers. And then 10.9% reported using electronic vapor products in the past 30 days. And again, Beth pointed out something really great at the beginning. Our questions do not frame what is in the vape. So we list out some brand names and things like that. We have a separate marijuana question that asks how they use marijuana, so if they vape it, but the question just of electronic vapor products is just framed up as a tool. So. And then, like I was saying, so we have this crossover in our field that we're seeing between mental health and substance use. We know that they drive each other regardless of whichever one is the source of the issue. And so really in wanting to compass that and make sure that we're addressing every risk and protective factor that we can. Last cycle, we pilot tested several mental health questions and then permanently added several questions to our instrument this cycle. So these 3 questions were all pilot tested last time. So it's asking students in the last 30 days, how often did you feel nervous or anxious, depressed, sad, or hopeless, and then a desire to be alone all the time. So we can see pretty similar results for the region and Butler County, but we're seeing just under 40% say they're nervous or anxious all or most of the time. About 25% saying that they're depressed, sad, or hopeless, and about 30% saying that they had a desire to be alone all the time. So little slight increases from last cycle to this cycle for nervous or anxious, depressed, sad or hopeless. And for the region, we saw a pretty significant increase in those who's reported that they had a desire to be alone all the time. So it went up from about 20% to 29%. So definitely something to keep an eye on, of those continued feelings of isolation amongst youth.
I always like to just kind of jump in on this slide and say too, these are not kids that necessarily have a clinical diagnosis of anxiety or depression. And so we like to think, and just in working with young people, there's a little bit less stigma around mental health language. And so they may be reporting out this way, but this is something that we want to look at to make sure that if they do need those services or supports, that they might get a clinical diagnosis if needed.
Yeah, absolutely. And so a few of these questions on this next slide, kind of overall school climate and other mental health factors, we had been asking for several cycles, and then a few of them were pilot tested last time, and I believe that middle one was a brand new question this time. So for several cycles now, we've been asking students in general, how often do you feel stressed? And it's a spectrum of, all these questions are asked on the spectrum of never, seldom, sometimes, often, or a lot. And this is that combined percentage of those who said often or a lot. So about 53 to 54% of students saying that in general, they feel stressed often or a lot. And I can say that this has been pretty consistent for the last couple cycles, hovering between 50 to 55% of students saying that they're frequently stressed. Suicide ideation. This is asking students, so have you ever considered attempting suicide? And so we can see about 11% of students. This was a slight increase from last cycle. And then this was a brand new question that we asked. So my emotions cause problems in my life at school. 25 to 26% of students saying that often or a lot their emotions are interfering with their life at school. And then screen time. So this is asking kids about how often do you spend time on Xboxes, laptops, computers, phones, outside of schoolwork. And so we see about 55 to 56% of students saying often or a lot they're engaging in screens. And so this is definitely something we're keeping an eye on, because we know that this can have a huge connection with poor mental health. And then similarly, this was a question that we pilot tested last time, and we permanently added it to the instrument, was in general, have like video games ever affected your school, your job, your work? Like you've been playing too much video games. And we see about 14 to 15% say often or a lot. That's up from about 8 or 9% last cycle of students saying that often or a lot it's negatively affecting them. And then this was a section, 3 of these were asked last cycle. This last one we added brand new this cycle. So I can discuss my personal problems. And when students were given examples of personal problems like sadness, fears, hopes, worries, with at least one adult in my home. So we saw about 52% of students saying often or a lot they could talk to one adult in their home. That was really a great number that we saw continue to stay around upper levels, especially with the opportunity for increased engagement. That was one positive thing with the pandemic, is students and youth were spending a lot more time with their parents and able to form those connections. One adult at my school, so we saw 27.7% say often or a lot for the region, and then 24% for Butler County. So this was a little bit of a decrease from last cycle that we saw. But in general, I think a lot of that had to do with that lack of physical connection to the school. We saw, for basically the past, year and a half prior to us administering the survey, students were spending significantly less time at school, if any at all. And so I definitely think that led to the decreases in them reporting that they had that protective factor of someone at their school. But similarly to one adult in my home, I have one friend that I can discuss my personal problems with. 61% and 60% for Butler County said often or a lot. So positives that students were able to maintain those strong connections with their friends. And then again, this was a new question. I think it might have been somebody from Butler County that suggested this, just in talking with our people that run, outside of school activities and things like that, making sure that we had a way to capture those people that might not be at school, might not be at home, but still have the opportunity to engage with youth and be that protective factor. So we saw about 34% for the region and 32% for Butler County. They often are a lot. They had one adult outside their home or school that they could talk to. And then school safety, school violence, these two sections of questions that we have on our survey actually came out of a partnership that we had with Safe Schools, Healthy Students, which is a statewide project. So wanting to make sure that we were capturing that on our survey. So we've asked this for several cycles now, but in terms of personal safety, one highlight from the survey is 21% of students report being afraid another student will hurt them at school. 111 students, so 0.8% reported carrying a gun to school. And that was actually a decrease from 2019, which was 2.7%. 16% of students report getting hurt at school. And then about 5.2% of students reported being bullied at school. So definitely all things to keep an eye on and to, work to create programming and things with schools to mitigate that. And then I'm gonna hand it off to Portia.
And what are some of the things that we can do for you? Well, we have a variety of free programs, materials, and services that we can offer. We have free training, education, the drug use data analysis, and we have a coalition development, hidden in plain sight. And that is a display that we can take and bring it and show you drugs that are just hidden in a teenager's room. We have our youth development, we have our parent education, we have our marijuana education, and we have our Search Institute, the 40 developmental assets, which is protective factors. Being able to have adults build relationships with children. And we know building those relationships are important. So good protective factor. And we have our social emotional learning. Countywide, these are some of the things that we're doing. So as Rachel mentioned, we have our billboards, we have campaigns, we have free training that we offer, and that's to increase the awareness and capacity and community in our systems. We have our Handle with Care, EMS, fire, police, and schools, and other free services that we offer. We have our drug disposal bags. And I just want to bring your attention, we have some upcoming events and trainings. We have our Tall Cop drug training, which is May 2nd. We have our Faith Summit in Fairfield, which is May 6th. We have a vaping event for educators that's June 1st. We have our Youth Leadership and Team Summit, June 16th. And we have our FCFC Resource Expo at Fairfield High School, which is August 5th. And I also want to share an opportunity. I know Martina and Tyrina, they are part of the task force, and if they wanted to share anything, I saw you on here. I can't see you guys, but they are part of the task force with me as well.
I can't see if they're still on there. I can't make my screen any bigger while they're on, but
Well,
Martina or Ty, if you want to plug it, or the next full task force meeting is June 3rd. And then of that picture of all the different subcommittees, they work more on the treatment, harm reduction, and recovery side, where we're focused on prevention.
yes. And so we have this upcoming event. About it.
We're just all trading off here.
Yeah.
So yeah, June 1st, which I believe is a Wednesday, from 12:30 until about 3:30, we're planning on doing our marijuana and vaping trends luncheon. So lunch will be provided, and it is specifically for school staff, principals, resource officers, paraprofessionals, anyone who is in our schools and working with our youth. We would love to invite you to come out and join us, learn about the trends that's going on. Can't guarantee this, but hopefully maybe hear from a couple youth themselves about like personal stories and why they choose to get involved in substances, and how we can support our youth with not using substances and increasing protective factors. But also, like you mentioned, the schools are also struggling right now, just in general. They have a lot on their plate with dealing with these substances and just coming out of the pandemic. So also we want to see how we can help as prevention professionals, how we can work to increase just better schools and better overall community engagement and happy, healthy lives for all. So that's kind of what we're doing. I'm really excited for this. Like I said, there is free lunch, to come out and learn a little bit. Tell all of your school professional friends. So yeah.
I'm excited too. We get to do this event together.
And yeah, that will be here at the Butler County Educational Service
Yes.
Center.
Yep. And so we always joke in coalition work, we all say we. And so sometimes when I'm working with people in the private sector or somewhere else, they're like, but who do you mean when you say we?
Yeah.
It really is a collective effort because we are combining all of these different coalitions from the different geographical locations and across those issues, because we know that the protective factors will combat the risk factors in the same way across all of those different issues. So you'll see all of our love for all of the logos for everybody who's involved, but there's lots of hands and that makes light work. So
Exactly.
We're
We're
happy
stronger
about that.
together.
So thank you. Does anyone have any questions?
Yes, of course. Wonderful presentation. This is Joe from the Fairfield Prevention Coalition. Wonderful work. And we're just starting to look at our school district data so we can do some internal work on prevention strategies. But I just want to put a question out there. Has anyone in the Butler County area, have they done a 40 developmental asset survey, either the attitude and behavior survey or the developmental asset profile? Do you know of anybody who has done that? Because this is something I'd like to bring to the table for our consideration, which is just a survey on protective factors.
it's been many years since we've used the survey. It's something we could be open to look at. I know we've been asked this summer to train several different church groups on helping caring adults working with kids, especially with trauma and behaviors and all of that different stuff. But it's something we could potentially look into.
And the reason I ask is because, you know, there's 8 categories of developmental assets, the list protective factors, and it kind of gives you the direction of what's lacking for our young people, which category. So I just want to throw that out in the mix that we may consider doing that.
Thanks, Joe.
Okay.
Martina, do you want to put a plug in for the Handle with Care and what you're looking for in case there's other folks on the call or here that are working and have a sphere of influence around that project?
Sure. Well, I'll just share an update, and then if anybody has any questions or does have a sphere of influence, and we can talk offline about that. But we have recently had a conversation with Middletown, and Middletown is ready to move forward, both the schools and law enforcement. So that's great news. It's huge. We will start training throughout the summer. So we're looking target training starting in July or in June, I'm sorry, to finish up in July. So that's awesome, awesome, awesome news. And then with that, Hamilton has a few little clusters to clean up on training. Fairfield's rocking it as always. So yeah, and then once we get those 3 big districts tackled throughout the summer, we're going to work on the smaller districts and get everybody up and running. So we're getting closer. We are getting much, much closer.
I saw where Joanna Lowry asked a question in the chat. Has Envision Partnerships done anything with the 40 developmental assets? I will also call on Buki here just to help me out in case I'm forgetting anything. I know that we do stuff with the 40 developmental assets. We have literature I don't think we do any official trainings, but I do think it's a part of the PACS tools that I was speaking about, which teaches children self-regulation. But I don't think we, to my knowledge, we haven't done anything with like the protective factors survey or anything like that. So I'm interested in that as
And
well.
Jamie Simpson is actually the trainer developed.
Okay.
Assets, and the council has all kinds of free, cool kind of swag giveaways that we use at different community events, but we share it with schools and community partners. Just kind of those tips of how to work with youth and show youth that you care.
My question probably to Sarah, when they're bring up that about the 40 developmental assets and those kind of surveys, are any of these like qualitative versus quantitative?
So to my understanding, the 40 developmental assets is still more like quantitative on like whether they do or don't have it in their lives. It's really the only qualitative kind of work that we do is focus groups. So whenever we do any sort of youth summits, we conduct focus groups there. We're always open if there's any sort of school district that would like to conduct some focus groups in their school. We are more than happy to come facilitate those and collect any data. But really that's kind of like our big engagement with qualitative data. And that's the opportunity to ask them, why do you see, kids using, what are some of your stressors that you're having, really get those like wide range of answers.
Yeah, so I would have to say, I probably would consider myself a qualitative kind of geek. I like conversations and, sometimes, yeah, so I would like to, so.
Because you can draw all the conversations out of all the people.
Yeah. Easiest way to do qualitative data is in a dialogue kind of session. That's usually when you get the best stuff. So any sort of like where you're asking people to sit down and like write out paragraphs, you're not likely to get good content or even a lot of it. But if you give people the opportunity to talk and share, especially youth, handing the mic over to youth, they are happy to just talk to anyone who will listen. So you get some good data that way.
And that is going into the plug for Be Heard, Be Strong. That is the youth. That's what they pick. So
They pick their own thing.
yes.
Because they say, don't talk about listening, but they don't listen. So they are going to be heard at this event.
Yeah. Any more questions?
Just want to thank you guys for doing all the hard work, but we're really excited now to move forward with, kind of realigning our strategies and make sure we're keeping up with the trends. So thank you all for doing all the work that you guys do.
And we can come out and share, do one-on-ones and speak. I know Sarah is out speaking, and I know that she can speak with us. We can go out and speak and share this information as well. That is something that we can provide.
All right. Well, thank you everybody for choosing to spend your lunch hour with us. We really appreciate it. And if there's questions that bubble up, you know how to contact us. And if you want to sit down, look at your data or talk about different evidence-based practices and how to use this data, we would be happy to be a part of that. Thank you.
Bye.
Thank you.
guys.